Good evening. Good evening, ladies and gentlemen. Good evening, Mr. Budiman.
Good
First,
evening.
good evening. Due to miscommunication, I'm afraid today, first we will invite Madame Ernia to give us the presentations in Portuguese, and after that, I'm going to give the presentations of two different topics, health topics, about the stomach esophageal reflex, about the GERD, and also about the stomach ulcers. So first of all, I need to talk to Madam Ernia. Madam Ernia, I have already set you as a co-host. So I'm going to present the two health topics in Portuguese.
Evening, Madam Rainey.
Good evening.
I'm trying.
Good
Hey,
evening, Madam Ernia.
can you please check your chat box, please, quickly?
Sure. Okay. Good evening, Madam Timby from South Africa. How are you? And good evening, all the international trainers and distributors and leaders for today. Very nice to meet you today. So, still, my question is, are you going to present the today's topics in Portuguese?
That's why I was sending the message, because I was not made aware that I was supposed to present in Portuguese. So I prepared in English, and there was no material in Portuguese. So the time I
Oh,
realized
sorry.
I wanted, yeah, the time I
Okay.
realized it was late for me to translate the material.
Okay.
Yeah.
All right. I think next time, please, I also need your email address so I'll be able to talk to you directly.
Directly, yes.
Okay.
I
All
tried
right.
reaching out on WeChat, but I don't think it
It's okay.
worked.
It's okay. So today, we're going to make it in English. Now, I really need to know from our audience, uh, does anybody doesn't understand English? So I want to know how many of us uh couldn't understand English because I hope that we're all bilingual. So you understand English and one of your language like Portuguese or French. So you can send us the information. I think most of us understand both English. Okay, so go ahead. Go ahead, please. Next time I'll make it very clear in which languages. Okay, all right. So are you going to share the screen with us or you want me to do that?
Uh, I'm trying to. Okay. Can you see it? No.
Not yet. Yes, now it starts sharing. Yes, we can see it. You can maximize it.
Okay, can you see it now?
Yes, we can see it. Um, you can put it in the mode of slideshow so we can see a maximized.
Yeah, I already started.
It takes some time.
Is it not showing in full? I've already shared in full.
Not yet. I believe it takes a few
Let me
seconds.
restart. It's not showing.
We see it is still it's not in full screen yet.
But I'm sharing in full this side, and it's in full this side.
You can just stop sharing and redo it.
Yeah. Okay. Is it fine?
Yes, now it is in full screen. It is very good.
Okay, perfect. Good evening, everyone. My name is Enyanya Shengo, and I'm a 7-star consultant from Mozambique branch. Today, we'll be discussing two topics, which is parasitic infections and chronic fatigue syndrome. Chronic fatigue syndromes, what will we be covering? We'll be covering what actually is chronic fatigue syndrome. We will cover what causes this chronic fatigue syndrome. We will discuss a bit of what products from Greenwald can we use to better the chronic fatigue syndrome, which is blueberry supernutrition. We're also going to be discussing blueberry juice, spirulina plus capsule, super CoQ10 capsule, blueberry coffee, and ganoderma coffee, and the lifestyle changes that people with chronic fatigue syndrome can adapt to in order to better their health. So what actually is a chronic fatigue syndrome, which is usually called CFS? If we look in medical terms, chronic fatigue syndrome is a complex and poorly understood condition characterized by extreme persistent fatigue that does not improve with rest and worsens with physical or mental activity. So these are medical terms that are used to basically characterize what chronic fatigue syndrome is. I will try to explain it in a way where for anybody that is listening, for anybody that does not really understand complicated terms, can be able to sort of understand what actually is chronic fatigue syndrome. Have you ever felt tired and it didn't matter how much rest you got, that fatigue or that tiredness would never go away? Whether you sleep 8 hours a day, whether you're not overworking yourself, because this tiredness comes in ways that you cannot explain. Maybe not you, maybe someone that you know. It's a type of fatigue that cannot be explained. Whether you rest enough, you sleep 8 hours or not, whether you are drinking enough water, whether you're exercising, there is this tiredness that you can't pinpoint exactly why you are feeling. This is what chronic fatigue syndrome means. I will explain deeper so that it does not get confused by underlying conditions sometimes, because sometimes people feel this chronic fatigue syndrome and can easily be associated with underlying conditions. So it's important for you to understand that it's not just any type of fatigue, that you take it as chronic fatigue syndrome. As we carry on, let's look into what causes chronic fatigue syndrome. So if you have a viral infection, for example, you can actually have a chronic fatigue syndrome. It's very easy to associate it with chronic fatigue syndrome. Also, if you have any immune system dysfunction, so anything that can make your immune system lower will actually cause chronic fatigue syndrome. So these are basically the underlying conditions that can easily, cause chronic fatigue syndrome. Also, when people who usually have hormonal imbalance, constant hormonal imbalance is not normal, is an abnormal condition. A lot of people mistaken this, especially ladies, mistaken this for, since we are ladies, it's normal to have hormonal imbalance. Hormonal imbalance can actually cause many other diseases than chronic fatigue syndrome. So it's something that is overlooked, but it's one of the main causes for chronic fatigue syndrome. Also, post-infectious syndrome. For example, people who've been infected by a certain type of disease, let's talk about TB, maybe COVID, can then develop a chronic fatigue syndrome. So it's something that in this case comes as a consequence of a previous infectious syndrome. Also, if you have a dysfunction in the mitochondria, you can easily develop a chronic fatigue syndrome. And if you have sleep disturbance, people who suffer from insomnia, people who are restless, people who suffer from chronic, actually, because there's normal and then there's chronic insomnia, can easily develop chronic fatigue syndrome. This is a giveaway because sleep is what we need to rest. 24/7, we need sleep to rest. So if we have a sleeping disturbance, we will not be able to rest. Okay, so excuse me. So from Greenwald, what are the supplements, what are the products that I needed in order to better your chronic fatigue syndrome? We have blueberry super nutrition. Blueberry super nutrition or blueberry juice, they both have blueberry, a very, very, very good antioxidant. It will support the mitochondria's health. It will enhance the immune function. So this blueberry juice and blueberry super nutrition are going to work as immune boosters. Once the immunity is boosted, if that is one of the underlying conditions for the chronic fatigue syndrome, it will automatically better the immune system, then lower the fatigue syndrome. It also has antiviral effects and reduction of oxidative stress. The reduction of oxidative stress is due to its antioxidant properties that both blueberry super nutrition and blueberry juice have. We can also look into spirulina plus capsule. This capsule does a lot of work at the same time. In this case, where we're talking about chronic fatigue syndrome, it is nutrition support to alleviate the fatigue syndrome. So it serves, the nutrients in spirulina serves to alleviate the chronic fatigue syndrome. The antioxidants properties in spirulina, which are phycocyanin, beta-carotene, and other carotenoids, superoxide dismutase, polyphenols, vitamin C and E, and chlorophyll, are very, very good antioxidants to remove these toxins and relieve the chronic fatigue syndrome. When we look into another very important ingredient that we have in spirulina, which is the American ginseng, it will help alleviate in chronic fatigue syndrome because it's classified as an adaptogen, meaning that it helps the body adapt to stress and restore energy balance. So what happens when someone has chronic fatigue syndrome? It means that their liver is not producing enough energy. If it's not producing enough energy, it cannot balance out that energy. So the spirulina, the ginseng content, the American ginseng content existing in the spirulina plus capsule will help balance the energy. So it will restore the energy production in the liver, which will then help the balancing of the energy. Excuse me. This is usually helpful for the chronic fatigue patients who often experience extreme fatigue. Because there is levels, there is a mild, there is a small, and then there is severe symptoms to this chronic fatigue syndrome. So the ones who experience profound or extreme fatigue, this is very, very, very beneficial to them. I wanted to, one second, I just wanted to suggest, because I see a hand up, I just wanted to suggest to the person that they write, if it's a question, maybe they write it on the chat box and we can attend to it at the end of the presentation, right? It also has an increased ATP production. Ginsenosides, the active compounds in ginseng, enhance mitochondrial function and ATP production, improving cellular energy availability. So remember, one of the underlying conditions is mitochondrial dysfunction. So this increased ATP production will enhance the function of the mitochondria. Therefore, it will improve the cellular energy availability. It also has a stress response support. right? The hypothalamic pituitary adrenal HPA axis is often dysregulated in chronic fatigue syndrome. American ginseng will then help modulate or balance cortisol levels, therefore balancing stress responses and reducing symptoms of adrenal fatigue. It will also improve resilience by supporting the HPA axis. It might reduce the physical and emotional exhaustion commonly seen in chronic fatigue syndrome. So it's not just the physical, also the emotional exhaustion that is seen. That is one of the most seen symptoms of chronic fatigue syndrome that will be improved by supporting the HPA axis with this ingredient of American ginseng. Now, looking into the CoQ10 capsule, it will boost the cellular energy production. It will reduce oxidative stress. It will alleviate inflammation. It will enhance cardiovascular function and support cognitive function, modulate the immune function. When the cellular energy production is restored, right, or boosted, energy levels are going to be higher than the energy levels of someone that suffers from chronic fatigue syndrome, right? This is what CoQ10 will do. CoQ10 is a very important coenzyme that will regulate the energy production on a cellular level. So now we're talking about the cells themselves. So CoQ10 will be used specifically to boost the cellular energy production. So the more cellular energy production there is, the more the total energy production there will be. Also, it will be used to regulate stress and alleviate any inflammation that may be caused by the chronic fatigue syndrome. When CoQ10 enhances cardiovascular function, as most of us may know, most of our productivity heavily relies on the cardiovascular function. People who suffer from chronic fatigue syndrome, they feel tired even before they perform any activity. Now imagine if they had to go on a run or they had to go cycling or practice any exercise for their health. So this is also an impairment for them because as much as they want to improve their health by exercising more regularly, they will not be able to do it as good as someone who doesn't suffer from chronic fatigue syndrome because they get tired faster. So as they drink the CoQ10, it will help enhance the cardiovascular function so that it's able to work the way it was designed to work. People with low vascular elasticity, high vascular resistance, with a lot of myocardial oxygen consumption will really struggle, already struggle. Now imagine those people now with chronic fatigue syndrome. It will decrease all the functions, all the cardiovascular functions. So by drinking this CoQ10, it will really help boost. At the same time, it will support cognitive function due to its properties that works as a coenzyme. All coenzymes are very good for the cerebrovascular function, which is your cognitive function. And it will also modulate immune function. So now already we've spoken about blueberry juice, super nutrition, spirulina, and CoQ10 comes and boosts again this immunity. So all these supplements, you need to understand that all these supplements are playing their own role, as much as some, very few of their roles are similar. Each one of them, all those contributing factors that come together, they help in, they help in boosting the immune function. They help in bettering the chronic fatigue syndrome. Now, as most people might know, coffee the caffeine in coffee works as a natural stimulant, right? Now it boosts energy, it gives you better energy and stuff. But now we're looking into a healthy coffee because most of the coffee is not healthy. We're looking into coffee that is healthy, which is the blueberry coffee and the Canodema coffee, natural and healthy, right? The blueberry coffee and both blueberry and Canodema coffee have anti-fatigue properties in them that already will serve as a natural stimulant to boost the energy in people who suffer from chronic fatigue syndrome. Okay. These are basically the life changes that someone who suffers with chronic fatigue syndrome needs to adapt to, right? The first thing is energy management. When it comes to energy management, a person suffering from chronic fatigue syndrome needs to be able to manage their energy wisely, not overuse their energy. Try the best to save their energy while they keep on all these other practices that I'll discuss to slowly and surely better their chronic fatigue syndrome. They are already supplementing because we come in this order. They're already supplementing. They're already drinking these supplements that are going to help bettering this condition. But here are some lifestyle changes that they can implement in order to better their overall condition. So supplementing, we always say this, supplementing alone is not enough. People need to adapt to the supplements lifestyle. So you buy supplements for whichever reason, but you need to adapt to this healthy lifestyle. The minute people are consuming supplements, they are choosing a healthy lifestyle. So it is not good to choose a healthy lifestyle and then carry on with all those old bad health, all those bad health habits. It is no good. So you've taken them through starting to consume healthy supplements, right? Health supplements. Now their lifestyle needs to adapt to this choice of consuming health supplements. So energy management, going back to energy management, it is very important, even for people who do not yet suffer from chronic fatigue syndrome, to prevent themselves from suffering from chronic fatigue syndrome. It's very important that okay. Sorry about that. It is very important for people who also are not yet suffering from chronic fatigue syndrome to take up steps, to take up changes that will not lead them to suffer from, excuse me, not lead them to suffer from chronic fatigue syndrome. So as I was still explaining, energy management is one of the most important ones. You do too much work, you overuse your energy, you don't rest enough, you will start saturating your body. Slowly but surely you might end up getting chronic fatigue. Physical activity, staying active is very important. Your cardiovascular health depends on it, your immune system depends on it, and these, as we've been seeing from the whole presentation, are two of the most important factors when it comes to determining whether someone might end up with chronic fatigue syndrome or not. So it's very important to stay active. Find a fun exercise to do, stick to it, and make sure you keep on being active so that you help the energy production in your livers and you don't suffer from chronic fatigue syndrome. Sleep optimization. Sleep optimization is very important, and I like how it's being said. It's not being said as sleep. It's being said sleep optimization. Everybody sleeps. Is everybody optimizing their sleep? No. No. Everyone is going to bed. Is everyone actually resting? No. If you're going to bed to sleep or to rest, but you are constantly worrying or stressing about something, you are not optimizing your sleep. Let that be clear. So it's very important. It's a highlight that we're not speaking about sleep. The lifestyle change here, we're not saying sleep 8 hours per day. We are saying rest when you actually do rest when you are sleeping. So many people close their eyes, but they don't rest. So this relaxation, a full body relaxation as you go to sleep, that is what is called sleep optimization, right? Diet and nutrition, I cannot emphasize this enough. I cannot be clear enough. Diet and nutrition is what is taking so many people to have so many health issues. For someone with or without, these lifestyle changes don't only apply for people who have chronic fatigue syndrome. Yes, it is a highlight. It is a must for people with chronic fatigue syndrome, but it's also a wake-up call for people who do not yet have it and can use these tips as prevention. Diet and nutrition, it's very important to know what you are eating every day and why you're eating what you're eating every day. You don't just eat to feed yourself. You eat knowing, is this good for me? Is this nutritious or not? And you ask yourself that question with everything that you're about to put in your mouth. Very, very, very important. So your diet and your nutrition is very important for you to prevent or to treat chronic fatigue syndrome, right? And as we as I already had mentioned, greenwood supplementation without fail. Very good immune boosters, very good antioxidants that we discussed, very good for your cardiovascular, very good for your cerebrovascular, very good coenzymes. Greenwood supplementation is going to be a very, very good way to treat chronic fatigue syndrome. It's important to mention also that the chronic fatigue syndrome, there's so many people that suffer from it, but they are not aware. That's why even in the definition, it says that it is a very not well understood concept because so many people suffer from it, come back from work exhausted every day. They quickly associate it with, no, I was looking at papers the whole day. No, I was doing this. No, I was doing that. But it's very important to understand when this is now a condition. Very important. There's so many people who suffer from it and they are not, no, I'm just having a hard week. I'm just having a hard month. I'm just having a hard 6 months. I'm just having a hard 1 year. No, that is now chronic fatigue syndrome, when every time, no matter how much rest you get, you feel exhausted. And this will affect your liver, will affect the kidneys. And as we might know, excuse me, as we might know, kidneys are affected for women, gynecology is affected for men, male function and prostate are affected. So it's these conditions that now, just a tip for other health consultants that might be here. These are the conditions that now you must look out for when you're treating a patient, because you might treat a patient and then they come back over and over and over again complaining about some same things and saying, no, I've drank this, but I'm not getting well. I've drank this, but I'm not getting well. You might be wondering what is actually happening with this person. So it's important to look out for such things as chronic fatigue, things like chronic fatigue syndrome. Thank you. Madam Rainey,
Yes, Madam
I
Ernie.
don't know, do you want to comment something before
Uh,
I
I'm
move on?
Yes, let us check whether we have any questions in our chat box. So, ladies and gentlemen, kindly, if you have any questions, please type in the chat box. No, I don't see any. Uh, okay, we can proceed with the second topic. Madam Ernie, shall we proceed to Shall we proceed?
Okay. Let me see.
So far, we don't have any questions. Ladies and
There is
gentlemen,
no.
do you have any questions about the chronic fatigue that Madame Ernie just presented? If you have any questions, you can type in your chat box. Okay, we do have one. Thank you, Madam Ernest. We do have one here. Low energy levels in the liver. Or I think what you mean is low energy level caused by liver disorders. I suppose. What other causes? Liver actually is the organ that process all the nutrients we eat, from the carbohydrates to proteins to fats. Actually, it does all this chemical processing uh, almost every second, and also liver is its place where all the toxins and friendly thing for you maybe it's not, but for liver it is toxic. For example, like the alcohol, like the medicine you take, and all the toxins, the remaining residues of the chemical fertilizers, herbicides, all these chemicals, heavy metals actually are being broken down and processed as less harmful substances in of liver. So actually, of liver is doing a lot of things. And by the way, liver is also break down the excess hormones. So for hormones in our body, if we find that the hormone level is extremely high, is abnormally high, then the liver will be responsible for break it down. So liver is, let me put this way, energy stress all the time. So if the liver cannot function properly, then it will cause the low energy levels in our body, and the overload of the toxins in the bloodstream. So that is why the chronic fatigue, like what Madame Ernie has presented, can also caused by the liver dysfunction. So in this case, you can definitely use the Livergen capsule or Hepatosure capsule. Even if you don't have these two products, Chitosan capsule is one of a very good product for liver, and also Ganoderma. Ganoderma is extreme, is especially good for those people who have already have certain damage in their livers, and they have already have the elevated liver enzyme levels. So you can take the Ganoderma. So you have quite a few choices to deal with this situation. So I hope this also can satisfy you. So, Madame Ernie, please kindly proceed with the second topic, the intestinal parasites. Okay, thank you. Let's put it in a slideshow mode to full screen, please. Yes,
It's
thank you
not
so much.
screen.
Now it's full. Thank you.
Wait, I just want. Okay. Oh, it's not moving to the next one.
You can stop sharing and redo it. Sometimes it does that.
Hmm? Okay. Is it moving?
Yes, it is moving.
Okay. So on the second part of our presentation, we will be discussing intestinal parasitic diseases, right? What are actually intestinal parasitic diseases? They are organisms that live in the digestive tract of humans and animals, of, often causing a range of gastrointestinal symptoms, including vomiting, diarrhea, and abdominal pain. These are just some of the symptoms that such intestinal parasitic diseases can cause. So the most common intestinal parasites include amoeba, roundworms, tapeworms, pinworms, and so on. So these are some of the most, there's a lot of intestinal parasitic diseases, but these are a list of the most common intestinal parasitic diseases. Roundworm, we have roundworm, tapeworm infection, hookworm infection, entamoeba infection, pinworm infection, and cryptosporidiosis. These words and cryptosporidiosis. So, we will quickly discuss what each one of these infections what each one of them are, and basically how one can get this infection so that you are aware. And this is also very important for the health consultants when they are discussing a health scan, a full scan, so that you understand one or two underlying conditions that you might not be able to easily pick up from a scan. So when does a roundworm infection actually happen? It happens when roundworm eggs are ingested. So when you ingest roundworm eggs, this parasitic infection happens. It's usually through contaminated water or food. They are found in soils. These eggs are found in contaminated soils. These soils are usually contaminated by human feces. So these places where there is no good hygiene and people end up leaving their feces on the open air, this is where these worms are found. They contaminate the soil, and then maybe there is a plantation that goes through somewhere there, and then you ingest it. That's how you end up with roundworm infection, right? And some of these symptoms include fever, include abdominal pain. In severe cases, it can even spread all the way up through to the lungs and cause some coughing. And there's also vomiting and nausea as part of the symptoms for roundworm infection. When we look into hook worm infection, right? This type of infection, it also happens when there's a contact with hookworm eggs. So there are hookworm eggs that when your skin gets in contact with them, so if these worms, for instance, let's say they're on a soil or something, if you are walking barefoot and you step probably on a contaminated soil, a soil that has eggs, that has hookworm eggs, that's how you end up getting the infection. And it can also it usually enters through the skin, and then it goes to the lungs all the way to the intestines, and that's where they actually grow, and now they form adult hookworms. That's how one gets hookworm infections. And one of the main symptoms for this infection is there's itching on the part of contact. So let's say, for example, you were walking barefoot, your part of contact will be under your foot. So when under your foot touches that contaminated soil, one of the first symptoms that one will feel is that that specific part will be very, very itchy, right? And then it can also cause one of the symptoms that can be noticeable is low iron. When the iron levels start to drop, in some cases, it even can get to anemia. That is one of the symptoms. In children, this also affects children. In children, how it manifests is that you will see a certain difficulty in their development. So in the growth of that specific child that has been infected by hookworm infection, you will be able to notice that their development or their growth is not quite so good, right? Next, we have pinworm infections. Under you can see the other name, which is enterobiasis, right? This is through contaminated food. So it's through your mouth, but now it's through contaminated food. This is one of the most common types of infections. One of the most common types of intestinal parasitic infections is pinworm infection. The food that we eat is most of the times not clean, especially when you buy food. There's a lot of times you consume food, you have no control over how the food was prepared. So you can't really pinpoint how you might have gotten the infections, because there's a lot of people that most of the times don't even eat at home. So how the food was prepared, out of your control. This is how you can get pinworm infection, through the food that you eat. If the food is already contaminated, you might get pinworm infection, right? The next one is tapeworm infections, tyaniasis. This is a type of infection that develops in a form of a tape. That's how the infection develops, in form of a tape. This is usually due to undercooked meat. There's a lot of undercooked meat, especially the grilled or fried food. It's a lot of people's preferences to eat it when it's undercooked. So if that specific meat that you're eating is already infected by tapeworm infection, or the bacteria or the parasite, actually for that infection, you might get tapeworm infection that easily. So your steak, pork, undercooked might not be the safest if that meat already has that specific parasite, right? And next we have amoeba amoeba infection. This is due to bad sanitary conditions. Bad sanitary conditions, we're talking about hygiene in simple terms. So in your kitchen, you don't clean enough, toilets are not clean enough. These are the type of worms that can be found. And in such places that can infect you with the amoeba infection, right? And some of the symptoms are weight loss or occasional fever, stomach tenderness, and loose feces. If your feces it's not supposed to be hard, but if it's way too loose, then it might be a symptom for this word is one of the ones that's killing me. Amoeba infection. Sorry about that. And last but not least, we have cryptosporidiosis. This is usually common in people with AIDS. People with AIDS already have an underlying condition where the immune system is low. So it's very easy for the people who, ever since the olden ages, it's very easy for the people who already have AIDS as an underlying condition to get this type of infection, right? So what does Greenwald have to offer as the products against intestinal parasites? One of the products is Parashield capsule, one of my favorite products. Parashield capsule, it's sequesterpine, lactones, and other active ingredients in these products can disrupt the parasite cell's membrane, leading to their death. So what does Parashield do? It discontinues the growth of such infections. So remember, that these parasites, they have cells and then they keep on spreading. That's how they spread throughout and become an actual severe infection. So the cis-keterpene lactones and other ingredients in Parashield are able to discontinue and stop the shredding or the growth of this specific, excuse me, of this specific, of such specific infections, right? And the cooling and calming properties of this product may alleviate symptoms such as abdominal discomfort, bloating, heat sensations caused by parasite-related gastrointestinal distress. So besides it being able to discontinue the growth of these cells, what does it do? It can also alleviate, because how we know we are ill, how we know we are suffering from something is because of the discomfort and the pain that we feel. So besides it killing the disease from within, as it's killing the disease from within, it will also alleviate the pain. It will also alleviate the suffering that you might get from from the from the suffering that you get from the infection. Another thing about the Parashield capsule, we are advised to try and remove parasites from our gastrointestinal function from time to time. 6 to 6 months, kids is from 3 to 3 months, and we do not. We live with parasites, we live with bacteria. As much as we go and alleviate ourselves every day, we still do not sometimes remove all the parasites that are supposed to be removed. Some people suffer from constipation. That is even worse. So these parasites they keep on accumulating and they can cause you other diseases. They can cause you hernia. They can cause you so many other diseases. And then when you drink the Parashield capsule, it basically works as that. It removes parasites. So you don't have to wait until these parasites are causing an infection in your stomach. Once you are doing it from time to time, you are already removing this parasite so that it does not become what? A severe infection. Another product that is very good against intestinal parasites is garlic oil capsule. Allicin, which is a sulfur-containing compound in garlic, disrupts the metabolic processes of parasites, making it difficult for them to survive. So the specific component called allicin in garlic oil will basically make it difficult for these parasites that are already there, that already exist in this person's stomach or gastrointestinal function. It will make it difficult for them to keep on surviving because it will cut their metabolic processes. And the garlic compounds can also paralyze certain types of parasites, helping the body expel them naturally. Remember, the body is supposed to expel these parasites naturally without the aid of anything. So now we have some compounds in garlic oil that can paralyze specific types of parasites and make the body itself remove these parasites, which is what we need. So remember, we naturally alleviate ourselves. So with these specific compounds that are there in garlic oil, that will help that when we are alleviating ourselves, some of these parasites are already leaving. That's why we explain the importance of looking into these products to help you remove these parasites and relieve yourself from the infection, from the intestinal infection that you might have. Garlic has anti-inflammatory properties, and they usually help reduce gut inflammation, promoting faster healing and relief from symptoms caused by parasitic infection. We also have multivitamin tablets for adults and for children, and spirulina. Spirulina is powerful. It comes also this side. With vitamin C, it will support the immune function and healing. Zinc will help in immune system function and gut health. We have B vitamins. These are the compounds in the multivitamins. We have B vitamins, all the complex B vitamins, which are vital for energy production and proper digestion. We also have the iron in spirulina. Parasites can lead to iron deficiency, especially if they cause blood loss. So iron-rich foods may be necessary. So this is why spirulina is now going to be important here. If you guys still remember, when we're talking about chronic fatigue syndrome, we spoke about how it can cause iron deficiency, right? So these iron-rich foods may be necessary. Spirulina works there, spirulina works here. It's a very powerful supplement. Another product against intestinal parasites, which is blueberry super nutrition. It is an antioxidant and it has antioxidant and anti-inflammatory properties, antimicrobial and antibacterial effects. So microbes and bacteria cannot survive blueberry super nutrition. And it also supports gut health. This is a very good supplement also. We saw it that side on the, we saw it that side on the chronic fatigue syndrome, and we're seeing it again here on the intestine. It just goes to show you how wide of a range blueberry super nutrition has. It has so many good benefits. It comes decides to play on the stomach. It plays on the immune system. It has antioxidants. It has anti-inflammatory. It has antibacterial, antimicrobial, supports gut health. So many nutrients in this supplement. And how can one prevent intestinal parasites? This is the advisory part of this presentation. The first main thing, practice good hygiene. When we talk about practicing good hygiene, we're not only talking about the hygiene when you're cooking your food, which is washing your vegetables properly, making sure you're disinfecting your vegetables, disinfect the area that you're using to cook also. Wash your hands before you touch any food related item. Whether you're about to touch a pot, whether you're about to touch anything that involves food, wash your hands before. And by washing your hands, you wash your hands with soap and you thoroughly wash your hands. Not that washing hands where you open the tap water 2 seconds, you are done. No. The washing your hands where you actually get to wash your hands. You take soap, you actually hygiene. You use hygiene to wash your hands and you take your time, right? In some cases where you might not be able to wash your hands, sanitize. Number 2, safe food and water practices. When I was talking about food, when I was talking about practicing good hygiene, I had already started touching on food. Food is not being washed and catered for carefully. You need to actually wash your vegetables. I've seen so many wrong ways of washing vegetables. Where you wash vegetables in that same water, you keep the last time you wash it, you keep it in the same water where the last dirt is. It does not make sense. Make it make sense. So it's one of the tips where you think you are done washing. You think, yes, it will never be 100% clean, obviously, but it will be as clean as possible. It will be safely clean because this is what we need. The level that we need is a safe level of cleanliness of this food. Water practices. Do not drink tap water. Tap water is not clean. Tap water is not safe. I'm not sure in other continents, but in Africa, tap water is not clean at all. So drink mineral water. If you might not be able to get mineral water, boil your water so that these things can die. Drink clean or treated water. We cannot emphasize this enough. It is very dangerous to drink water that is not clean. You will keep toxins, you will keep pesticides in your stomach. Drink purified, treated water. Avoid contaminated sources. Anything that might look contaminated, that might seem like it can get contaminated, avoid it at all costs. If you are working somewhere and you see that the hygiene conditions are not so well, make sure to avoid such places because it's very, very, very easy. Even if you remember when we were still talking, even if you are not, we're talking about pinworm infection, even if you're not working barefoot, you might still be working with flip-flops and still touch the soil. So avoid, as much as you can avoid, you avoid. Sanitation, very important. Very important. Bathroom sanitation, very, very, extremely important. There's a lot of germs in the bathroom. A lot of germs in the bathroom. So sanitation there is very important. Preventive medication. These supplements are not only to treat, but they are only to also to prevent. Remember when we were talking about Parashield? You can use Parashield to prevent. So if you are already using Parashield to prevent, that means that each 6 months, you're removing parasites that might be forming, might be trying to form in your stomach. You are already removing them. So there won't be a chance for these parasites to actually develop and cause any harm. Also, it is very important that you educate family, community, friends, everyone, because it is not enough for you to practice this and not have them practice the same. Why? You go to such people's places, you share spaces, you share food. So all these contamination, the main contamination factors you share with family and community. For example, you don't educate your community on not having their feces all over the place or anywhere. You don't educate them on where to throw the trash at a proper place and stuff like that. You haven't done much because you are doing it alone, but you might still get contaminated by what someone else is doing. So you will be fine with the hygiene practices, the good hygiene practices that you are having, but not the other people. Vaccination and animal care. This is very important. If there's any vaccination to prevent, especially in children and animals, if there's any vaccination to prevent the spread of any type of worms, it is very important to adhere to such things. Depending on what the vaccination is all about, it is very important in some areas. There's some areas where there's a lot of these infections and it's very, very, very important for preventative methods to be adhered to. So in such areas, it's very, very, very important that you try your best to adhere to, because once again, you don't adhere to it, you will probably get contaminated and in some cases even end up spreading due to poor hygiene practices and sanitation. Thank you.
Thank you so much, Madam Ernia. We have learned a lot. Thank you for such wonderful presentation. Okay, first let's answer those questions. Only a few questions I see. For kids who has, chronic fatigue. Normally kids don't have. If kids really you find the kids is less energetic, lethargy, you got to really have a checkup to understand whether there's something missing from the kids. Maybe a vitamin or mineral deficiency or iron deficiency anemia. So go and check up because normally we don't really, without diagnose, to give kids anything. But multivitamins for children is good. It provides all the vitamins, and also the blueberry juice is a very good product. Kids will love it, and blueberry juice can provide vitamins and minerals, including iron. So if that kid is suffering from iron deficiency anemia, blueberry juice is one of the best products. Also, there's another question. The differences between the chitosan, the livergen, and hepatitis. Good question.
Hello.
Uh,
Quale c'è?
Okay, as for the difference in between these three products, first of all, they work in different way. Chitosan works by binding with the extra sugar, extra cholesterol, and the heavy metals, and taking them out of the body without being digested. By doing this, it reduces the workload of the liver. So it is one of the good detoxifier. So it reduces the workload of the liver. So this is how it helps with the liver problems. And also for Livergen, it is a very good liver detoxifier. For Hepatissure can help the liver cells to repair themselves and to regenerate themselves. So if you have a slight liver diseases that you can use the Hepatissure. As for Ganoderma, I have mentioned that for elevated liver enzymes, you can recommend the Ganoderma. So I think we answered most of the question. Okay, one more. I think, without the pear shelled and the garlic oil, what other products can get? Well, pear shelled and garlic oil are the strongest. I don't know why. Maybe those products are unavailable in your country. We feel sorry for that. You can try propolis, but we are not very sure. We checked that propolis is very good for bacterial infection. But as for parasites, propolis is not as strong as the other two products, but you can try. First of all, we need to understand what type of parasites. Madame earlier has presented so many types, and beside this, there's some other rare type of parasites, intestinal parasites. So we got to understand. So if pear shelled and garlic oil are not available, and if propolis cannot really work well, you really need to go to a deworm program under the instructions of the doctors. Okay, thank you. Thank you, Madam Ernie, once again. Next, I'm going to present you the two topics. Actually, the two topics are very similar with each other. One is the GERD, and the other one is the stomach ulcer. So, okay, let's start sharing the slideshow with you. So let me check. Okay, so it has many names. Sometimes people call it just a acid reflux, or sometimes you can hear a term called GERD or cord. Sometimes it's just people call it heartburn. So it has so many names, but actually, this common condition, many people actually have sometimes in some time of their life experience this. I myself experience this esophageal reflux after I eat chocolate, after I eat the spicy food, and also sometimes, the sweet potato. If I add, overeat sweet potato, I may have this problem because some food will cause this problem. I'll explain to you why. Before we dive in, let's start with a quick question. How many of you have experienced uncomfortable burning sensation in your chest after eating, or maybe a sudden rush of acid into your throat. Don't worry. We'll explore what GERD is, why it happens, and how Greenworld's nutritional solutions can support your journey to a better digestive health. So, okay, let's get started. First of all, let's talk about the telltale symptoms of GERD. Many people dismiss acid reflux or heartburn as a minor discomfort, but this could be signs of a more serious condition. Let's break it down. The key questions to identify if you might be experiencing GERD. Have you ever felt a sudden surge of acid water into your mouth or throat? That's called acid regurgitation, and it's a classic symptom. Do you experience a burning sensation behind your breastbone, right here, or below the breastbone, about an hour after eating? This is the heartburn, and is often caused by stomach acid flowing back into the esophagus. So these symptoms aren't just uncomfortable. They're your body's way of signaling that something is off. So let's move on to why we need to take them seriously. GERD just isn't just about occasional discomfort. If left untreated, it can lead to more serious issues. But first, let's understand how the digestive system is supposed to work. Normally, stomach acid stays in the stomach, helping breaking down the food. But in people with GERD, the lower esophageal sphincter is a kind of muscle working as a valve or, as a door to close, the disconnect or to close the food pipes, the food tubes, or the esophageal, and make all the food stay in the stomach instead of going back to the esophagus. So this is what's this lower esophageal sphincter. This is kind of muscle. So it must close properly. This allows the acid to flow uh, into the stomach and not go back to the esophagus. But if this valve doesn't close properly, then the food mixed with the stomach acid will flow back to the esophagus and irritate the food pipes. So imagine your esophagus has a sensitive pipe and stomach acid as a strong detergent. So repeat exposure to acid can damage this pipe, leading to more than just heartburn. So let's list the potential symptoms beyond the obvious ones. So chest pain might be mistaken for a heart problem. Always get chest pain checked. So if you feel that pain here, you really need to go to the hospital to check whether this pain comes from your heart or comes from your esophagus. Digestive dysfunction, like feeling full too quickly or indigestion that lingers. Chronic cough or sore throat caused by acid irritating the throat and lungs. And also the globus sensation means a feeling of a lump in your throat, even when you're not swallowing. Dental erosion from the frequent acid exposure in the mouth. Sleep disturbance as lying down can make the acid reflux worse at night. So does any of this sound familiar? If so, we've got to really understand what might be causing your symptoms. GERD doesn't happen randomly. Several factors contribute to its development. So let's go through them one by one, starting with age. As we get older, the lower esophageal sphincter, this muscle, can get weakened, making it harder to keep stomach acid in place. So this is why GERD becomes more common in middle-aged and old adults, but it's not exclusive to them. Sometimes young people can also experience this. Number two, medications. Certain drugs can relax the muscle, the sphincter, or increase the stomach acid. Examples include the painkillers, like the ibuprofen, some antidepressant, and even high-dose vitamin C supplements. So if you're on long-term medication, talk to your doctor about GERD risks. Some people I realize after eating high dose of vitamin C, they find they get heartburn. Number three, unhealthy lifestyle habits. Here's where many of us can make changes. Strong tea, drinking excessively, too much coffee, alcoholic beverage, and high-fat food, especially those deep-fried food, all relax the sphincter, the muscle, or increase the acid production. Smoking is especially harmful. It not only weakens the muscle, but also reduces saliva production, which normally helps neutralize acid. Some of the food can cause relaxation of the sphincter, including chocolate, tomato, sweet potato, and spicy food. Mm. Number four, increased intra-abdominal pressure. This affects people with conditions that put pressure on the abdomen, pregnant women, obese individuals, or those with chronic constipation. Frequent vomiting or jobs involving heavy lifting are more prone. The pressure pushes stomach acid upward, leading to a reflex. I can't stress enough the importance of addressing GERD early. Let's look at the complications that can arise if acid reflux is left untreated. Number one, the upper gastrointestinal bleeding. Chronic acid irritation can wear away the esophageal lining, causing small tears or ulcers. This can bleed, leading to symptoms like black tarry stools or vomiting blood. The latter is a medical emergency. So this is the number one complication. Number two, esophageal stricture. Repeated inflammation can cause scar tissues to form in the esophagus, narrowing it over time. This makes swallowing difficult, and in severe cases, solid food can get stuck. Gradually, your esophagus gets scarred and narrow, so you can't not swallow solid food. Number three, Barrett's esophagus. This is a precancerous condition where the cells lining the esophagus change. They become more like stomach cells. While not everyone with GERD develops Barrett's, the risk increases with long-term and treated reflux. So regular monitoring is very essential for those diagnosed. Now, I don't want to scare you more, but to understand this, it's very important to prevent you from getting the esophageal cancer. So let's look at some statistics about the GERD prevalence. Well, did you know that GERD is a global issue, even in regions we might not expect? Take South Africa, for example. In urban areas, the prevalence of GERD has risen from 10% to 18% in just a decade. That is a huge jump, similar to Western countries. And here's the catch. Many cases are asymptomatic, meaning people don't realize they have it. Why does silent GERD happen? Reduced mucosal sensitivity. Firstly, aging or diabetes can change the esophageal nerves, blunting acid perception. Secondly, timing of reflux. A brief nighttime reflux episode may go unnoticed but still damage the tissue. It happens in the night when you're sleeping. so you don't know, but the damage is there. Third, non-acid reflux. Bile or alkaline reflux may not trigger classic heartburn. Why does this matter? Because silent reflux can still cause damage over time. A study highlighted that urbanization plays a key role. Think stress, sedentary lifestyle, and diet changes. In other regions, lack of healthcare access means we don't have accurate data, but the trend is worrying. Now let's shift focus to those who already have GERD. So what can you do to manage its symptoms? So managing GERD is a combination of medical care and lifestyle adjustment. So let's go through the key steps you can take alongside your doctor's prescribed medication. Number one, maintain a healthy weight. A BMI below 25 reduces abdominal pressure. Even losing 5 to 10 pounds can make a significant difference. So think of it as easing the pressure on your, the sphincter, the muscle. Number two, elevate your bed head. So when you're sleeping, you raise the head of your bed by 15 to 20 degrees. So you can use the bed risers or a veg pillow. This gravity trick keeps acid from flowing back while you sleep. Number three, avoid late night eating. Stop eating at least 3 hours before bedtime. Lie down with a full stomach is a recipe for reflux because you have a full stomach, and since your stomach is full, your stomach produce a lot of strong stomach acid to help you digest the food. So by doing this, definitely you will have reflux. Try sipping herbal tea instead if you get hungry. Number four, quit smoking and limit alcohol. We've talked about how smoking harms the lower esophageal sphincter. Alcohol relaxes the muscle and increase acid production. Cutting back can drastically reduce symptoms. Number five, release constipation by eating more fresh vegetables and fruits. High fiber foods like fresh vegetables, fruits, whole grain foods keep digestion moving. Reducing the abdominal pressure. Stay hydrated too. Water is your digestive symptoms' best friend. Number six, avoid tight-fitting clothing and prolonged bending during work. Opt for comfortable clothing and avoid prolonged bending over, like the gardeners or like other workers who needs to actually working on the production line. This can trigger the reflex. Okay, so this change might seem small, but together they create a big impact. So now let's talk about which products can help support your GERD management. Number one, Greenworth's philosophy centers on endogenous nourishment for holistic well-being. So today, we'll focus on two powerful supplements, Spirulina Plus capsule and Chitosan. These two products actually are the best products for this condition. Spirulina actually is a superfood from nature's pharmacy. Spirulina is a type of blue-green algae packed with nutrients. But what makes it special for GERD? Let's break down its nutritional mechanisms. When stomach acid repeatedly irritates the esophagus, it causes mucosal inflammation, similar to a skin abrasion. You have swollen and painful, but this time it's not skin, it's your esophagus. Phytocyanin, that's blue-green pigment in spirulina, act as an anti-inflammatory guardian, directly inhibiting, the inflammatory agents to calm the esophageal inflammation. Meanwhile, it's rich in beta-carotene and superoxide dismutase, which are powerful antioxidants that neutralize the harmful free radicals from acid reflux, forming a protective shield around the mucosa to minimize the damage. For stomach acid regulation, spirulina polysaccharide act as a valve on the stomach's acid factory. Animal studies show they reduce the total stomach acid production and inhibit the key enzyme for acid secretion. Actually, you can consider it anti-acid products, cutting off the acid ammunition at the source and lowering the risk of esophageal irritation. In simple terms, if GERD is like strong acid, uh, corroding a pipe, spirulina both repairs the damaged pipe by reducing the inflammation and decreases the acid production, offering dual protection. For the spirulina plus capsule, the recommended dosage is 1 to 3 capsules each time, 1 to 2 times a day. Start with a lower dose and just based on your body's response. So the second product is chitosan capsule. Now let's talk about chitosan. This is a natural fiber derived from shellfish shells. Don't worry, it's purified, so it's safe for most people, even those with mild shellfish allergies. But always check with your doctor if you're concerned. So if you know that somebody is allergic to seafood, be careful. Let them start from 1 capsule because many people who are allergic to seafood are not allergic to chitosan at all, but only a few do. So check whether you're allergic to chitosan by starting from the low dose. Chitosan can form a physical barrier. In acidic environment like the stomach, chitosan becomes positively charged. It binds to the negatively charged mucus lining of the esophagus and stomach, forming a protective barrier. Imagine it as a liquid bandage that coats and shields the irritated tissue from acid. Promotion of mucosal repair. Chitosan also activate the epidermal growth factor receptors, which stimulate the growth of the new esophageal epithelial cells. So this speeds up healing for any damage caused by acid reflux, helping your esophagus recover faster. Always remember that before we make chitosan into a dietary supplement, let's say 50 years to 80 years ago, chitosan was used for dressing the skin wound. Actually, if somebody has burn, has the skin abrasion, then you actually use the chitosan to help the wounds heal. So, if it can help the skin wound heal, it definitely can help the healing of mucosal membrane. So that is why we recommend the chitosan. Take 2 capsules of chitosan each time, twice in a day. For best result, take them with water on an empty stomach so they can form the protective barrier before meals. To wrap up, GERD is a manageable condition with the right approach, a combination of lifestyle adjustment, medical care, and targeted nutritional support like greenwood supplement. Remember, small change add up to big improvements in your quality of life. So thank you for joining me today. Remember, your health is your greatest wealth, and every step you take towards better wellness matters. So if you understand about the esophageal reflux, you will definitely understand the next topic I'm supposed to share with you, which is the stomach ulcer. Okay, I'm going to share with you about the slides show about the stomach ulcer because basically these two conditions they share the similar uh, courses but slightly different because the stomach ulcer has one more reason, uh, one special bacteria, the H. pylori. So sometimes, you know, the heartburn actually is behind, actually is at the chest level. It's at the, the upper position. But your stomach ulcers, actually, it is right in your stomach. So think of them as a painful hole in your stomach lining. So over the next 5 minutes, uh, we'll break down what causes them, how to spot them, and how to manage the stomach ulcer with Greenwood products. Excuse me. So first, let's start with the basics. Do you often feel a burning or pain in your upper abdomen about 1 hour after eating? That could be a stomach ulcer. Uh, so when you eat, your stomach makes strong acid to digest the food. But if there's a sore in your stomach lining, the acid will irritate it and cause the pain. So this is kind of like pouring lemon juice on a cut. So you just feel it's especially painful. Other clues, the pain may come and go, feel worse at night, or improve after taking antacid, or after you eat starchy food, it will help you to release. But don't ignore it. If it keeps happening, check with a doctor, maybe just indigestion, but better safe than sorry. So now let's talk about the signs that might mean you have a stomach ulcer. Besides that burning pain in the upper part of your stomach, pay attention to other clues your body might be giving you. Do you often feel a dull discomfort in your upper abdomen, like a constant unease that won't go away? Maybe you've lost your appetite recently, or you're losing weight without trying. You might start avoiding certain food because they make you feel worse. Frequent belching, that sour acid reflux in your chest, nausea, or even vomiting. These are all red flags. So if you notice several of the symptoms together, especially if they come and go regularly, please make sure that uh, your mobile phone is in silent mode or you set as muted. Okay, so they can come and go regularly. So don't brush them out. Your body might be telling you it's time to see a doctor and get checked out. Stay alert to your body's signals. Early attention can make a big difference. So, what is stomach ulcers? Uh, Let's start by talking about stomach acid. Your stomach makes strong acid to digest food. Stomach acid is actually a liquid secreted by the stomach, mainly composed of hydrochloric acid. This is a strong acid. Beside that, it also contains pepsinogen, mucus, and intrinsic factor. The hydrochloric acid gives stomach acid its strong acidity. Under normal conditions, the pH of gastric juice is about only 1 to 3.5, very acidic, which is roughly as acidic as the white vinegar, but stronger. How does stomach acid aid digestion? Firstly, it activates digestive enzymes. Secondly, stomach acid kills the bacteria. Third, it helps break down food. Fourth, it regulates gastric emptying. Then why
Madam
does
Lady,
stomach?
sorry.
Yes?
The slide is still not moving.
Not moving? Okay,
The
I'm
slide,
going to
yeah,
stop sharing
yes,
and
please. Thank
read
you.
it again. Because sometimes this could happen.
Yeah, because of the network.
Okay, now I stopped sharing, and I'm going to restart. You please tell me whether you can see the. Okay, let me see. Now I'm moving the slide. So can you see it? Can you see it is moving?
Yeah, we can see Madam Rai.
Ah, sorry, is the slide moving?
Yes, it's moving, but is the slide is still the GRD.
Okay,
It's not
let's
it's
close it
not the
completely
mm,
and restart everything. Okay. Now I'm moving the slide. Can you see it? No, still
it's
no.
not move. It's not
Okay,
still
okay,
the gastroesophageal. Yeah, it's better
okay,
to restart again.
okay, I'll start it. Now, can you see it moving?
Yep.
Okay,
Yes.
okay, now I can see it.
Yep.
All right.
Yes.
So, we have talked about the symptoms. So, now let's talk about what is the nature, what is exactly is the stomach ulcer. Now, um first, we can see that uh, stomach ulcer is a serious condition. If left untreated, stomach ulcers can lead to serious problems. So, number one, upper gastrointestinal, this way, upper gastrointestinal bleeding. This can happen if the ulcer erode a blood vessel, leading to blood in your stool. So actually, your stomach uh, mucus lining has a sore. So if this sore erodes and blood vessel, so it can cause bleeding. So when this causes bleeding, you may either throw up, vomit the blood, or the blood goes into your intestine and you find that you have tarry stool. So you can see that your stool becomes very black and like there's tar. We all know that we use the tar to pave the road. So it's black, but it is shining like there's a tar in your stool. So this suggests that, there's bleeding in your digestive system. Number two, perforation. Imagine a hole puncturing through the stomach wall. So that's extremely dangerous and can cause infection in your abdomen because your stomach is full of food and the strong stomach acid. So once these things go into your abdomen, it can trigger severe. This is an urgency that you need an urgent operation. So it can cause the severe infection in your abdomen. Number three, gastric outlet obstruction. Ulcers near the pylorus, which means the exit of the stomach, and the connection between the stomach and the small intestine can swell and block the food from moving into the intestines. So finally, well, rare, there's a small cancer risk with long-term untreated ulcers. That is why early diagnosis is the key. So if you're diagnosed with an ulcer, don't get discouraged. Treatment is available. For mild cases, doctors usually prescribe two types of medications. Number one, antacid or acid suppressing medication, like the proton pump inhibitors or H2 blockers, antacid. So this reduces the acid in your stomach, giving the ulcer a chance to heal. Second, mucosal protective medication, like the sucralfate or the bismuth preparations, which coat the stomach lining like protective gel. For severe case, surgery might be needed to reduce the acid production. But remember, treatment takes time. Mild ulcers take 3 to 6 months to heal, and complex cases up to 1 to 2 years. So let's dig into the root causes. Ulcers aren't just bad luck. They're often a mix of factors. Number one, gastric acid and pepsin. These digestive substances are necessary, but too much or a weak mucus barrier can lead to damage. Number two, the special bacteria in our stomach, the H. pylori. Sorry, I need to mute you. We have a special kind of bacteria called the H. pylori. If our stomach is infected by this bacteria, this bacteria can attack the mucus barrier and inflames the stomach lining. Now, let's talk about the H. pylori infection in Africa, reviewed by WHO data. First, the overall infection rate is very high. According to WHO 2020 data, the median infection rate among adults in Africa reaches 72.5%, almost 73%. That means every 10%, there's 7% to 8% who are infected by this H. pylori, which is much higher than the global average of about 50% in some countries, like Nigeria, and Ethiopia. The infection rate even exceeds 85%. So it means almost all the adults are infected by H. pylori. Another key point is early childhood infection. In sub-Saharan Africa, the infection rate among children under 5 years old, about 30 to 50%. This indicates that children are exposed to the risk of H. pylori infection at a very young age, possibly through the environment they live in. So we can see that H. pylori infection is a significant public health concern in Africa, especially the high infection rate in adults and the easy exposure of children, deserve of great attention. Why we have such a high rate of infection? If one person in the whole family, one person is infected through sharing the food and the dishes, if we don't disinfect the dishes, we only wash the dishes. And sometimes in Africa, because we don't have enough water, we don't wash dishes under the running water. We use a bucket of water and we wash all the dishes in the same bucket of water. So actually, if other people use the same, excuse me.
Mimi mchina ananiuliza watoto wangu. Naambia mtoto wangu mwingine.
So if the whole families share the dishes, use the same dishes, if one person is infected by this H. pylori, and all other family members could get infected. So this is the reason. Number 3, mucosal defense issues. Sometimes the body's repair system fails, leaving the lining vulnerable. Number 4, medications like NSAID, the painkillers. It means non-steroidal anti-inflammatory medicine. For example, if you have joint pain, you may go to the pharmacist and buy this kind of painkiller. Ibuprofen or aspirin, they can irritate the stomach lining if taken a long term. Number 5, genetics. Some people may have a genetic predisposition. Number 6, lifestyle factors. Alcohol, smoking, stress, even gastric stones or radiation therapy can play a role. So it's a combo of this that often leads to ulcers. Now let's talk about how to avoid ulcers or prevent the flare-ups. So simple lifestyle changes can make a big difference. Eating a balanced diet with easily digested food like whole grains, lean proteins, and veggies. Portion control, avoid overeating, and stay away from spicy or overly acid foods that can irritate your stomach. Limiting caffeine and alcohol. Strong tea, too much coffee, and alcohol can all weaken the mucus barrier. Moderation is key, or cut them out if you're prone to ulcers. Regular meals, eat on a schedule. Don't skip meals and chew slowly to aid your digestion. Exercise gently. Moderate exercise like walking or yoga can reduce stress and improve digestion. Managing stress, practice mindfulness, meditation, or even just take time to relax. Stress hikes up acid production. Greenwood Nutritional Products, providing nutritional intervention. Now, I want to share some nutritional products that can support the stomach health as part of holistic approach. So these are from Greenwood and are developed to complement medical treatment, not to replace it. First, Greenwood Spirulina Plus capsule. This blue-green algae is packed with nutrients. How does it help? Anti-inflammatory. I said that it contains the phytocyanin, the blue-green pigment, which reduce the inflammation in the stomach lining. So think of it as a natural fire suppressant for gut inflammation. Antioxidant. It is rich in beta-carotene and SOD. It fights the free radicals caused by stomach acid and H. pylori, protecting your cells. Acid suppression. Studies in animals show spirulina polysaccharide can actually reduce how much acid your stomach makes. That's great news for ulcer healing. So this is the first product. The second product is the chitosan capsule. Chitosan capsule, we have said, is a fiber derived from the shellfish shells. Excuse me. It forms a physical barrier. In your stomach acid environment, chitosan becomes a positively charged and binds to the negatively charged mucus layer, forming a protective film. So it is like putting a bandage over the ulcer. Healing promoter. It activates the receptors that help epithelial cell grow and migrate, speeding up the ulcer healing. Antibacterial. It fights H. pylori by disrupting their biofilms, making them more vulnerable. So you can take 2 capsules twice a day. The number 3 product is propolis. Finally, Greenwood propolis capsule. This is a natural resin created by honeybees, acting as a potent antimicrobial defender in nature. Number 1, it fights H. pylori. Components like the CAPE, caffeic acid, phenyl ester. Sorry, there's a special kind of chemical, the CAPE, and the quercetin in the propolis exhibit bacterial effects against H. pylori, the H. pylori bacteria. So it reduced the bacterial colonization in gastric mucosa. Number 2, antioxidant activity. The flavonoids effectively scavenge the reactive oxygen species. By doing this, it decrease. Sorry, I hope you're muted. Okay, thank you. So I'll continue. So because in propolis there's antioxidants, so this antioxidant can neutralize the free radicals and decrease the lipid peroxidation damage. And also it has immunomodulatory effects. It actually propolis is immune booster. It boosts the mucus production and the blood flow to the mucosa, strengthening your stomach's natural defense systems. So you can take 1 to 2 capsules 1 to 2 times a day. So to recap, stomach ulcers are painful, but they're treatable and preventable. You can take those preventive measures. Know the symptoms, such as the burning pain, nausea, weight loss, and don't ignore them. Get a gastroscopy if you are concerned. Treatments include acid blockers, protective medications, and sometimes surgery. Lifestyle changes matters. Eat well, manage stress, avoid irritants. Nutritional supplements like spirulina plus capsule, chitosan capsule, and propolis capsule may offer additional support to people with the stomach ulcer. So now we take time to answer some of the questions. So, okay, let me see. Oh, we have quite some questions. I have heartburn after eating kales. Oh, this is not, yes, eating pumpkins. Uh, Pumpkins, sweet potatoes, those are the vegetables that can first make your stomach produce more acid. And number two, they can relax the sphincter. But for kale, I'm not sure. I love kale. Okay, exactly my problem now, chronic cough. I know somebody who have this chronic cough caused by this irritation of the esophagus. So make sure you use our products. Let's go to the next. Can children under 8 years use chitosan and spirulina? For children of this age, we don't really recommend using the chitosan and spirulina. Do you know what products can help? You can use the blueberry super nutrition, 1/3 sachet, and mix it with water and let the children eat, go with the meal. So this will also protect, forms a protective film in the children's stomach because it contains almost all the very powerful antioxidants. And also, it contains the fructose oligosaccharide. This actually is a protective agent to stomach and intestine. So for children, use this and also give the zinc tablets of children. Zinc can help the healing, can promote the healing of any wound. So zinc tablets for children plus blueberry super nutrition to kids. How do I assist an elderly type 2 diabetic man who constantly suffers from diarrhea? First, control the blood sugar level by using the glucoblock, balsam pear tea, chitosan. You got to understand that chitosan, if you use chitosan properly, it can help with both diarrhea and constipation. So use the chitosan plus the products that can control the blood sugar level for this type 2 diabetes. For how long should one detox using chitosan? Again, which product can be used for? The liquid from the the chronic inflammation. This is a very, very annoying and troublesome some problems. So I know that somebody could experience this year and year without, sometimes it heals. But when the immune system is down, then it comes back. You have to really go see a doctor because most of the medications and food supplement we eat doesn't really go to our inner ears. they have to use the ear drops to kill this. But of course, you can give the immune booster. Any of immune booster and natural antibiotics, like the propolis, the chitosan, garlic oil, aloe vera, they can help. And also you can use any of the immune booster, like the Ganoderma, cordyceps, or ginseng RHS, but see a doctor. And the doctors will actually they just do a very micro operation. They open up it and drain the pus outside, and then they wash this with antibiotic solution, and then after that they put the ear drops. So this is how they treat this kind of inflammation. uh, hernia is normally you got really go to see a doctor for an operation to reduce the pressure of the abdomen. What we can do is helping him to reduce, the pressure of the abdomen by giving them the products to prevent the constipation. Because when people have constipation, the abdominal pressure goes very high and can worsen the hernia. But to treat this health problems, operation. Okay, thank you very much. I think we answered all the questions. We're going to share this slideshow. I'm going to send this slideshow to Mr. Budiman, and he's going to share this in your WhatsApp group. Okay, let's go to the next one. What do you recommend for an elderly who vomits continuously when eating anything because the colon is blocked? The colon is blocked. If the colon is blocked, the first thing is not she vomit or he vomits, is he cannot go to the toilet. He cannot pass the stool. So please kindly check this diagnose again. So if anybody who has a blocked colon, then the first thing is he cannot relieve himself. He cannot go to the toilet. He cannot pass the stool. He cannot defecate instead of vomiting. Please, you got to really check what exactly the diagnose. For any blocked colon or blocked intestinal obstruction, you're not supposed to eat anything but undergo a surgery. This is an emergency. So please, this is not a condition that the Greenwood food supplement can help. Go for a surgery because this is an emergency to me. A totally blocked or partially blocked. But even if it is a partially blocked, you got to really go an operation before we suggest any food supplement. Because if the intestinal get obstruction, the food or the residue of the food cannot pass. This is an emergency. For hernia, I said for hernia is to reduce the abdominal pressure by giving products that can help with constipation, aloe vera plus capsule. We also have the spirulina plus capsule. We also have the mycellulose and chitosan capsule. All these products can help with the constipation. But to remove this condition from the root, go for an operation. Okay, thank you so much for today. I'm sorry that, we didn't do a presentation according to the schedule. Next month, I make sure, sorry, excuse me, I make sure that both Madame Ernia and Madame Stephanie receive everything clearly in emails. So otherwise, sometimes by using this other kind of communication ways, sometimes we can make mistakes. Sorry for this. And next month, I'll make sure that there are going to be presentations in Portuguese and French. So thank you so much.
All right. Thank you, Madam Rainey, for the uh, a long-awaited training, especially for this gastric issue, the H. pylori, the ulcer, and also the acid reflux or GERD. Yes, in fact, we have many people having this problem. Well, related to this training, I have one question. We know Madam Reni already tell us the products for the gastric problem. Now, my question is, which Greenwell product should be avoid when somebody has this problem, this gastric problem?
Okay,
We know.
for gastric problem, let me think that the products you might
Is it like tea,
avoid.
green tea, coffee?
No, tea is very good. Coffee is good, but in mild, we said that moderation is the key. For example,
Mm.
all the tea, we have 8 to 9 teas in Africa. You consume 1 to 2 sachets in a day is quite good enough. Don't exceed that dose. As for coffee, I must say that normally for an ordinary person, 4 cups of coffee, that is the maximum 4 sachets of coffee. But for this type of people, you got to go 1 to 2 cups. Uh, Believe me, coffee sometimes it irritated the stomach mucus, and also it makes the valve, the lower esophageal sphincter muscle relax. Some of the food you check it, including chocolate. I'm a big fan of chocolate, but after I eat chocolate, before me, immediately within 2 hours, I feel the reflux because that valve relax and the food mixed with strong stomach acid goes up. So chocolates, sweet potatoes, tomatoes, those foods actually cause this problem, and the spicy food. So as for the products, coffee, you must know that. Sorry, 1 to 2 cup is okay, but don't drink more than that. Apart from this, I don't see any other products can
What
cause
about what
this
about
problem.
calcium? Calcium sometimes create bloating,
Now,
bloating sensation.
let me put this way. Uh, Calcium. Normally, calcium doesn't really cause problem if you drink adequate amount of water. And if you take the calcium after meals, because as for multivitamins and calcium, for this kind of supplement, don't take them with an empty stomach. So always take them after the meals. So you will see that small pills mixed with the food, so they becomes nothing. And then they immediately wrapped with a strong stomach acid and goes into the intestine. But if you take a product with empty stomach, not only calcium, not only the multivitamin tablets, but even some other products, you can feel the irritation in the stomach because for all these herbal ingredients, sometimes the stomach doesn't recognize them as a food, because normally in food you don't really eat ginseng and ganoderma and cordyceps. Still, our stomachs consider that they are herbs. They're not the common food. So it may cause some of the irritation if you take those products with empty stomach. Always remember, only for special cases we need to take them with empty stomach. Let me put this way: the clear 肠镜镜, you should take it
All right.
when you have
Yeah.
when you have an empty stomach. Chitosan, if you use it for a weight loss program, you have to take it before meals, 1 hour before meal, and drink plenty amount of water. So make it form something like the gel, the jelly, like the jelly in your stomach. So by doing this, you eat less. It creates a sensation of fullness. So only these 2 products that you take before the meal But most of the products, you are supposed to take them after the meal. Then you don't feel the irritation.
Okay. All right. Thank you. Thank you for the answer, Madam Rainey. And also, I would like to thank Miss Enya Nachengo from Mozambique. Yes, in fact, some of our distributors from French-speaking countries, they have been waiting for the training in French, but maybe later. We are very sorry for today because of the miscommunication, but we are going to arrange again. And I think, Madam Reni, we can contact like our trainer from Cote d'Ivoire, Mr. Musa Kamara, uh, Mr. Musa Komara. So I think he can help with the training. And ladies and gentlemen, so let us conclude for today. Next week, next Friday, we are going to have another interesting session. We are going to have the Diamond Club sharing. Diamond Club sharing. So make sure you tune in, and I will share the invitation to the WhatsApp group. And now let us unmute ourselves, and we can say thank you and bye bye to Miss Enya and also to Madam Rainey. Thank you.
Thank you, Madam Ernia. Thank you.
Thank you,
Mr. Rainey.
Madam Anya.
Thank
Thank you,
you.
Madam Rainey.
Thank you, ladies,
Thank you
for
for the
wonderful
excellent training.
Thank
Thank
you.
you, Madam Rennie.
Good night.
Thank you.
Thank
Bye.
you,
Yes.
Madam Rainey. Thank you so much.
Thank you, Mr. Rainey.